the second session that we've hosted as the PSC where we've had as our guest representatives from the alliance that will be administering the new Medicare Advantage program. I want to just say a couple things by way of introduction. I'm going to explain the agenda and the purpose of this morning's meeting. And then I'll turn the floor over to Kim Parker, who represents the alliance, and she's going to give a presentation and field questions from attendees. So you will have a chance to raise your questions and concerns this morning. As I said, I want to thank you all for being here, because at the PSC, we really do recognize that healthcare is really important to all of our members, and it's particularly important as one ages and retires. And so it's really critical that as the city contemplates this move from a traditional Medicare to a Medicare Advantage Plus program, that you have information that you need. I want to, first of all, begin by thanking the representatives from the Alliance, from the Office of Labor Relations. I'm going to let them introduce themselves in a minute. I want to also thank our Retiree Chapter Chair, the intrepid Bill Friedheim, for his amazing work. You, I hope, have received messages from Bill and the Retirees Chapter, along with messages from me at the Professional Staff Congress. I really want to thank Donna Costa, the PSC Welfare Fund Executive Director, Debbie Bell, the former Executive Director of the PSC, Barbara Bowen, the past president of PSC, and Dean Hubbard, who's the current Executive Director. And I'll explain momentarily how and when we'll get to hear from those folks as well. I see that there's already people asking questions in the chat, which is fine. You will have an opportunity after Kim Parker and Claire Levitt give their presentations. I guess it's really Kim who's going to be giving the presentation from the Alliance. I want to offer the instruction that you'll be able to raise your hand, which your Zoom hand is located under the reactions icon at the bottom of your screen. So I would encourage you to hold your questions in the chat. They're much more difficult to respond to in the chat, and you'll have a chance to raise your Zoom hand after Kim has a chance to speak. For folks who are just getting brought up to speed, I want to just give a very, very truncated explanation for why we are here today. As many of you already know, in the middle of July, the Municipal Labor Committee, which is the coalition of labor unions representing New York City employees, voted to approve a change in the administration of healthcare for retirees, including PSC retirees, and that agreement was made with the New York City Office of Labor Relations. So in place of traditional Medicare, the administration of retiree healthcare will be done by Emblem and Anthem, which is being referred to as the Alliance, and Kim is going to speak to us about that program now. As Kim will explain, it's a Medicare Advantage group plan, so it's a bit different from an individual Medicare Advantage plan, and it's scheduled to take effect on January 1st, 2022. So as I said, the purpose of today's session is really to inform PSC retirees about what the new plan is and what it isn't, and what your rights and responsibilities are. You'll have until October 31st to make a decision about whether to proceed with enrollment in the Medicare Advantage plan, and that will be the default, or to opt out and to continue with your traditional Medicare plan, which would have a monthly premium associated with it beginning January 1st. So our retirees have raised a number of really important questions, and so have our active members, our retirees in training, as Bill likes to call them. And so, Kim has been good enough to respond to many of those questions in a previous session. That session was recorded and it's available on our retirees website. We can paste a link to that, but hopefully those questions and more will be responded to this morning. I do just want to highlight before we get started that there is a toll-free number that the Alliance has made available. We'll be dropping that in the chat, and that the Office of Labor Relations has an FAQ page, as does the PSC CUNY Welfare Fund have FAQ pages. So those will be made available to you. I see that they're already been dropped into the chat as well. So thank you for the tech folks who are on top of that. The structure of this morning's session will be that the first hour will devote to a presentation and Q&A, so that Kim can talk about what the Alliance has proposed and has planned, and then she'll take questions along with Claire Levitt, who's with us from the New York City Office of Labor Relations. And then sometime around 10 o'clock or very shortly thereafter, we'll invite the representatives from OLR and from the Alliance to leave the meeting, so that PSC folks can have a debrief and a conversation among ourselves. And we'll ask Debbie Bell and Donna Costa and Barbara Bowen to help us, along with Bill Friedheim, in debriefing and responding to additional questions and concerns that our retirees may have. So that's all I have by way of introduction. Let's kick it off, and if we can ask Kim to begin, and when Kim is finished with her presentation, we'll open the floor for conversation and questions from you all. Thank you very much again for being here. Kim.
Thank you, James, I appreciate it. So let's see if I can pull up the presentation. Can everyone see my screen? And it's good view? Okay, perfect. First and foremost, I want to thank PSC CUNY for inviting me to come and present again. For many of the retirees that are on the meeting this morning, this might be a little bit of a repeat. I'm happy to say that I have some additional updates and some more information that I'll be sharing with you during this presentation. As I said, last time that I met with the group, my goal is to basically make everyone feel a little bit more comfortable about the change. I recognize the fact that change is kind of scary. So we want to make sure that everyone has a level of comfort to understand how the program works and what your options are, and basically give you some updated information. So during the presentation, I'm going to once again go over the overview of Medicare Advantage and basically how it works. We'll be talking about the national provider access, the enhancements to the plan, a high-level benefit comparison, and then open the floor for questions and answers. I'll also be addressing the premiums and the opt-out process, and also reviewing some of the communication pieces that you will be receiving in the mail over the next couple of weeks. The way a Medicare Advantage program works is the carrier is contracted with Medicare to cover all Medicare covered services. So the Medicare Advantage Plus program will become the administrator of your Medicare benefits, plus your supplemental benefits that you receive through the GHI Empire Senior Care Plan. So currently today, your Medicare is divided into two parts. You have Part A, which is your hospital benefit, Part B, which is your medical or doctor benefit, and then you have the Senior Care Supplemental Plan that pays secondary to Medicare. The Medicare Advantage Plus plan is rolling all of those pieces together into one single program. So the Medicare Advantage Plus plan will become the administrator of your Part A benefit, Part B benefit, plus we will act as the secondary carrier, filling in the gaps that Medicare doesn't cover. So it's rolling all of those pieces into one program. You will have one identification card. So currently today you have your Medicare card, your GHI card, and your Empire card. Under the Medicare Advantage Plus plan, you will have one single identification card. You'll also receive single EOBs under the Medicare Advantage Plus plan. Now, as a carrier that's contracted with Medicare, we're required to cover everything that traditional Medicare covers. So that is the base minimum. We must cover all services that are covered under traditional Medicare. We follow the same Medicare medical necessity guidelines. So if a service is covered under traditional Medicare today, that same service would be covered under the Medicare Advantage Plus plan. Now, in addition to everything that traditional Medicare covers, the Medicare Advantage Plus plan will also include additional enhancements to the program. And I have a slide that goes into a little bit more detail about those enhancements, but just to name a few, the new plan will have a transportation benefit, silver sneakers, a healthy meal program, fitness tracker, just to name a few of the enhancements. One of the most important or first questions that I've been receiving in all of these retiree education sessions is around provider access. And what providers will I be able to see under the Medicare Advantage Plus program? Members will have access to any Medicare participating provider nationally. So currently today, there's approximately 850,000 providers that participate in traditional Medicare. And of those 850,000, over 640,000 of those providers are actually in-network contracted providers with Emblem Health, Empire, or Blue Cross Blue Shield nationally. And currently today, over 90% of the providers that the City of New York retirees are seeing today are actually in-network contracted providers. So most of the providers you're using today are actually in-network. One question that comes up quite often is in regards to, what if I'm not in New York? What if I live in Florida or if I live in California? The program is national. So the program will cover you anywhere in the United States or the US territories. And we do have a national network of over 640,000 providers. I wanted to emphasize Hospital for Special Surgery and Memorial Sloan Kettering. This is a question that has come up in many of the retiree sessions. Both of those facilities, while they're not in-network contracted hospitals with Empire today, they currently see Medicare Advantage members under our program. So both of those facilities have agreed to accept the New York City Medicare Advantage Plus program. So for any retiree that's receiving services at either one of those facilities, you will be able to continue to use that facility and it will be covered under the New York City Medicare Advantage Plus plan. In order to determine if your providers are in-network or not, obviously it's a passive program, so you're not bound to the network of providers, but many retirees like to have that, I guess, level of comfort to know that their doctors are in the plan. There's two ways that you can easily find out if your provider is an in-network provider. You can either call the Medicare Advantage call center number, which is the 833-325-1190 number, and a representative can look up your providers for you. Or if you want to do a provider search on your own, it's very simple by going on to the empireblue.com website, and you'll go for Find Care. So when you go to the Find Care tool, you can search as a guest. So you do not need to be a member. So click on guest, and then you are going to select the following drop-down boxes. So the first thing is the type of care you're searching for will be medical care. You'll then do the drop-down for the state in which you're looking for the provider. The type of plan is a Medicare plan, and then the plan network is the New York City Medicare Advantage Plus network. So you'll be able to specifically look through the network that's linked to this custom network for the custom New York City Medicare Advantage Plus plan. And you can look for your providers by name, by provider type, zip code. There's a whole host of functions to be able to search. I touched upon this earlier in regards to some of the enhancements that are part of the program. You'll have Silver Sneakers, which is the free gym membership that's included in the program. There's over 16,000 Silver Sneakers locations nationally. You can use this Silver Sneakers locations in multiple states. So if you're traveling on vacation or if you spend the winters down in Florida, you can switch your Silver Sneakers gym location to wherever you're traveling to. We also have the non-emergency transportation benefit, which is 24 trips 24 one-way trips to doctor visits, hospital, or pharmacy. So this is basically a car service that's included in the program. You'll need to coordinate the car service transportation benefit at least 48 hours before your scheduled appointment. There's also a zero copay telehealth medicine, which is the Live Health Online. You can have virtual doctor visits right over your phone or tablet or computer, and it's a zero cost share for those services. Healthy Meals is members, it's mainly geared towards post-discharge from the hospital. Members can receive up to 56 meals per year delivered directly to their home. We also have the Healthy Pantry benefit, which is designed for members with certain chronic conditions to help them manage those conditions through dietary changes. I use a diabetic or a cardiac patient as a good example. It's proven that through a few simple dietary changes, it could have a direct positive impact on managing that chronic condition. So the member will receive a shelf-stable pantry box each month, as well as be eligible for nutritional counseling with a dietitian each month as well. We're also offering wellness rewards. So we want to incentivize members for doing their wellness screenings and preventive care. So when you have your annual physical or colonoscopy or mammography, you'll have the ability to earn rewards dollars, rewards gift cards for having those services done. There's urgent care and emergency care worldwide. So traditional Medicare does not cover you outside of the United States. Under the Medicare Advantage Plus program, you will have coverage for urgent and emergency care anywhere in the world. There's also Medicare Community Resource Support. And this is a service that will help members find different things that are in their community that could help support a Medicare member. Someone might need assistance with maybe shopping or helping someone install a wheelchair ramp. There's a lot of community services that are right in our own backyard that retirees don't know are available to them. And this community resource team will help connect the community program to the retiree. There's also the fitness, health and fitness tracker, which is basically a Fitbit. Members will be eligible for a Fitbit every 2 years, and you'll also have access to the online health and fitness tracker that coordinates with that Fitbit. I did want to touch upon the 24/7 nurse line. This is something different than the telemedicine. This is a nurse line that's available 24 hours a day, 7 days a week, to help members kind of triage their condition. So it could be something that happens in the middle of the night. Retiree may not know if they should go to the emergency room or if it's something that could wait until the morning to see their doctor. So members will have access to the 24/7 nurse line. I did want to touch upon the high-level benefit comparison. This comparison is specific to the GHI Empire Senior Care Plan, and I recognize that there are some retirees that may have HIP VIP, or they might have the Aetna plan, or one of the other plans that are offered through the City of New York. But since the majority of the membership is enrolled in the senior care, I wanted to give a high-level comparison between the Medicare Advantage Plus plan and the senior care plan. I wanted to emphasize the fact that the senior care benefits will be changing effective January 1st, 2022. So the senior care plan will now have a $15 copayment for primary care and specialty visits. So that is a change from what's in place today under senior care. So there will be a new copayment under senior care. Under both programs, whether it's senior care or the Medicare Advantage Plus plan, there is a $253 annual deductible. I wanted to call out the out-of-pocket maximum, which is different. Under the Medicare Advantage Plus plan, there is a $1,470 annual maximum out-of-pocket. Under the senior care plan, there is no catastrophic maximum out-of-pocket. So retirees would be continuing to pay whatever copay. So there is no cap on the senior care plan. This is important to call out for retirees that do not have the 365-day hospital rider. In those cases, a retiree could be exposed to tens of thousands of dollars in uncovered Medicare costs without the additional rider. So that maximum out-of-pocket catastrophic cap is important, because once the member reaches that out-of-pocket, there are no additional cost shares that the member would pay under the Medicare Advantage Plus plan. Both programs have the $300 hospital copayment per admission, with the annual maximum of $750 per person per year. Skilled nursing care is covered zero copay for the Medicare covered benefit period of days 1 through 100. Under the Medicare Advantage Plus plan, the PCP copay will be 0 and the specialist copayment will be 15. The emergency room copayment under both plans is 50, and then dialysis under both plans is a 0 copayment. Under the Medicare Advantage Plus program, I mentioned we're required to cover everything that traditional Medicare covers, and we follow the same Medicare coverage guidelines and medical necessity guidelines. The way the program works is the mechanics of it is just slightly different. While we're required to cover everything Medicare covers, there could be some services that would require prior authorization on the front end rather than a retrospective review that Medicare does on the back end. The prior authorization is handled by the providers, so this is not something that members need to be concerned with. It's handled directly between the providers and the plan, and the prior authorization is actually done online. The provider's office goes online, they log in the necessary information to request the prior authorization. Most of those services that require pre-authorization are your planned inpatient hospital stays, your surgeries, your complex diagnostics like your CAT scans, PET scans, MRIs, your therapies, your physical therapy, radiation therapy, your infusion therapies. Those are the types of services that require a pre-auth. Under the plan, you're not required to get a referral to see a specialist, so you do not need to go through a gatekeeper. You can go directly to a specialist on your own without a referral. The in-network providers are required to handle the prior authorization process for on behalf of the members. If it's an out-of-network provider, they're not required to pre-authorize services up front. What will happen is an out-of-network provider claim will be handled the same way it's handled under traditional Medicare today. The claim will be retrospectively reviewed for medical necessity after the service was rendered. So the prior authorization on the front end actually protects members because there's really no surprises in regards to knowing services are covered under the program. Noted on this slide is images of the communication pieces that retirees will be receiving. So every retiree should have received by now the notice of change letter from the City of New York. So that was mailed in August to all New York City retirees. The next few pieces that will be coming in the middle of September is the pre-enrollment guide, the FAQ document, as well as the senior care plan comparison. So those three pieces will be combined into one single mailer, and that will be going out in early September. So all retirees should have all of their pre-enrollment information and full enrollment kit by the end of September, regardless of what program you're enrolled in. Once the enrollments are processed, retirees will receive their identification cards in December, as well as the welcome guide will come in December, and then monthly member newsletters will start in January and thereafter throughout the course of the year. Members will have access to obtain an evidence of coverage document or a directory directly online, or they can request it through the call center. Now, I wanted to talk about the enrollment process, opt-out process, and some of the premiums. As James mentioned earlier, the New York City Medicare Advantage Plus program will be the new default base plan for the City of New York retirees. So all members are going to be enrolled into the New York City Medicare Advantage Plus plan for an effective date of January 1st, 2022. You will have an opportunity to opt out during the opt-out period, which is September 15th through October 31st. So if you want to opt out and keep your current plan that you're enrolled in today, you have the opportunity to do so. If you opt out of the plan, you'll be responsible for paying the premium difference between the Medicare Advantage Plus premium and your current plan. So if you are on senior care today, the opt-out buy-up premium is $191.57 for the base plan. If you want the hospital rider, it's $2.83. So basically for both of the plans to stay on senior care would be approximately $194 per member per month to keep the senior care plan. The HIP VIP program is a zero premium as well. So if you are in the HIP VIP plan and you do not want to go into the new New York City Medicare Advantage Plus plan, you can opt out to remain on the HIP VIP plan, and that premium would be zero as well. Some of the other programs, we are still finalizing the premiums with the City of New York. So Claire, I don't know if you have an update on when premiums will be available. I'm assuming within the next few weeks, the premiums for the other plans will be updated.
We should have them this week and they'll be posted on our website. And
okay, great, thank you.
Also, we can supply them to the Alliance so that your call center people have them as well.
Thank you, I appreciate it. I did want to emphasize the fact that the reimbursement for the Part B premiums will continue. So the City of New York will continue to reimburse you your Part B premiums as long as you are enrolled in one of the City of New York medical options. So you'll still be eligible for that. I think I touched upon everything that I wanted to in regards to the presentation. James, is there any question or any topic that you think I should address before we open it up to some questions from the retirees?
Kim, thanks. I know a lot of people have posed questions along the way in the chat. I mean, one thing I would just lead with before we open the floor is the time frame for receiving the packet of information and the enrollment kit has shifted back a bit, and I think it's made some of our retirees a bit uneasy, and I wondered if you could clarify and just ensure that the current target of trying to get that information out, I think you said early to mid-September, is going to be the final target for that, and that the question of opting out has also moved from October 15th to October 31st. And so I guess the preliminary question would be, are we still on track for getting that information out to folks in the time frame you've expressed, and giving them the time frame that's currently, on the FAQs for making their decisions?
Yes, the pre-enrollment guide and all of the materials are actually in the print venter being created and bound and shipped now. So the final approval of all the documents was received by both the city and the MLC. So we are on track to meet the delivery deadlines of mid-September. And one of the reasons why the city pushed back the opt-out period is because the member materials were delayed. Now, members can actually access the pre-enrollment materials directly from the OLR site, so they are uploaded. So if members want to look at the materials before they are actually received in the mail, they have the opportunity to look at those materials today. So they're on the OLR site.
Thanks very much. So I know there are a number of questions for Kim and for Claire. People have already begun raising their Zoom hands, which is great. I want to ask, I'm gonna call on a couple of people at a time so that we can get a couple of questions. A couple of questions articulated so Kim and Claire can respond to them. And just to let folks know, if you're not able to get your question answered by raising your hand this morning, there will be a link that's dropped into the chat. It's been dropped in already. Certainly you can call the 833 number, but there's also additional ways to get your questions asked and answered. There's a communications at PSC CUNY Welfare Fund email address as well. So that will continue to be placed into the chat as the meeting goes on. So let me ask Naomi and Sam if you could unmute the folks that I call on, and we'll turn the floor over to Kim and Claire to respond to questions. First, let's go to Susan Brown and then to Stanley Habib. Susan?
Hitting unmute, and can you hear me?
Yes, we can. Hi,
Great.
Susan.
Thank you so much. On two documents online, one on the plan comparison chart from that we received that's from nyc.gov, it says that if a spouse, that the retiree must pay for the 365-day rider, quote unquote, today, if they want to opt out and keep it. It was my understanding that with the senior plan, I already have that 365-day rider. Am I wrong?
Susan, thanks.
The 300, I'm sorry, James, go ahead.
No, that's all right. Go ahead and answer that one, Kim.
Well, the 365-day hospital rider under the senior care is a separate charge. So not every retiree chooses to purchase that hospital rider. So if you are paying something out of your pension for the plan, then you do have the hospital rider.
Would that be the $2 that I
Yes.
see? Oh, okay. Now, when I move over, if I pay the premium, which is $2.83 or something, $2.83, I can still keep that if I opt out.
Yes. So if you opt out, your new premium would be the $191.57 for the senior care plan, and then the $2.83 for the hospital rider. So your new cost would be $194 and change.
Thank you. One more fast question. It's really important. And that is that on another one of the documents, it says that for spouses of the member, that they will be completely disenrolled from their members' plan if they choose to opt out. Do I not get the same continued coverage as a spouse?
The enrollment is for all Medicare eligible retirees and Medicare eligible dependents of the city of New York. So I'm not sure what document you're referring to.
It's on the PSC CUNY WF.org FAQs.
Since that's Susan, since that's on our site, I'm going to ask Donna, who's the executive director of the Welfare Fund, to respond to that in the chat, or after Kim and Claire have a chance to respond, because that sounds like a discrepancy between the organization's information. We should get that ironed out.
Thank you. I'll look forward to it. And that does mean, though, that we will, as spouse, if we are Medicare eligible and on the plan now, senior plan now, we can continue.
That's correct. That's correct. You have the same options for your spouse that you have for yourself when you're both Medicare eligible.
That's exciting. And how will we pay for this? How will it be? Can we pay auto deduct from our checking account?
And yeah. Susan, sorry, after the question is answered, I'm just going to ask that we move to other
of course.
questions. I apologize. Everyone has a number of questions, understandably.
Thank you, Jane.
Yes, you'll be able to pay for it through a pension deduction.
Or from our checking account also?
That I don't know the answer to, and I will find out for you.
Thank you so much. Goodbye. Thank you.
Thanks, Susan. Stay with us. Don't go too far.
Oh.
Let's go to Stanley and Janice and see if we can do a couple questions in a succinct way.
Hi,
Stanley, hi.
thank you. This is Stan Habib, PSC CUNY retiree, and I understand that the CUNY Welfare Fund benefits will continue. Here's my first question. I'd like two, if I may. One is I received the Empire statements on any charges which start at the hospital. Unfortunately, Medicare is very bad about choosing whether to send the 20% to Medicare or whether to GHI. But put that aside because eventually it works properly. But what I'm concerned about is that this is Empire Blue Cross Blue Shield. And I'm in the Boston area now. And it turns out we use Brigham and Women and Mass General. And the Empire Blue Cross Blue Shield statement says you have used a provider that is not in the network, and consequently, you receive a lower level of benefits. I think my question really is a very good question for all out-of-state folks. May I have an answer?
The network that retirees will access outside of the New York area is the National Blue Cross Blue Shield Association network. So it's all of the Blue Cross Blue Shield plans across the country. So depending on what state you live in, it could be known as a different name. So for example, in Massachusetts, it's Blue Cross Blue Shield of Massachusetts. In Florida, it's Blue Cross Blue Shield of Florida, but it could be in New Jersey, it's Horizon Blue Cross Blue Shield. So it's the National Blue Cross Blue Shield network that you'll have access to. Mass General is in the network. And even if the hospital or a provider is not in a Blue Cross Blue is not in the Blue Cross Blue Shield network, we will still pay those providers 100% based on the Medicare allowable rate. So the provider is going to get paid the same amount of money. Your cost share will be the same. So there's no difference whether the provider is in network or out of network.
Thank you. One more question. If I were to predecease my wife, which we just don't know what's going to happen, now, Medicare Advantage is actually available to just about anybody who's over 65 and on Medicare. But would my wife have to make a separate arrangement with a Medicare Advantage program for her coverage if I were to predecease her?
She would be able to keep the New York City Medicare Advantage Plus plan as a surviving spouse under the program, and she would just pay the full premium for the plan, which would be $7.50 for this year. And then whatever the premium would be next year, it's going to be a zero premium. So, and I wanted to emphasize, this is a group plan. It's custom for the city. So it's not your individual off-the-shelf plan that's available to the open market. This is a custom plan specific for the city.
Thank you very much.
Stanley, thanks for your questions. Let's go to Janice, please.
I'm concerned about the future. This Medicare Advantage Plus plan is a 5-year contract, and the group plan information that I saw on the website says January 1, 2022 to December 31st, 2022. But both in the case of senior care and Medicare Advantage, what happens next year and 5 years out?
The plan that we have with the City of New York is a 5-year contract. So after the 5-year period is up, the city could extend that contract for 1-year periods. Claire, I don't know if you wanted to add any additional commentary to that.
Yeah, the expectation is that if this is working as we all expect it will, that it will continue beyond the 5-year period, and we can expect it to continue at a zero premium rate.
But it would be renegotiated in 5 years' time.
Well, we actually have an agreement of how the renegotiation will work beyond 5 years, so that we are able to continue it beyond the 5 years. So it's all been negotiated up front, and the zero premium is guaranteed for 5 years, and it's the expectation that that will continue as well.
Because no one wants to go through this period of uncertainty every year or every 5 years again.
I can certainly understand that. The city has an obligation to provide to provide cost-free coverage, and we intend to continue that.
Thank you.
Janice, thanks very much. Let's go next to Virginia and then to Ralph, please.
Hi, good morning. Thank you for all your hard work. I know this must have been tremendously difficult to get in line. I have actually a point of information. I called Hospital for Special Surgery on Friday to speak to my orthopedist, and I was told that they're going to no longer accept any type of Medicare as of January, that they're completely out of the Medicare system. And I asked her to repeat it several times because I was shocked. And she said they will come up with a plan whereby the employee will, the patient will pay about the same amount for their doctor as Medicare would pay. But that's all the information I have. She's going to call me back this week. So it's something.
This is a specific provider.
Excuse me?
It's a specific provider that you're calling about.
I called under my Medicare plan, and I asked specifically for the Medicare Plan Advantage of New York. And she said they are not taking any Medicare plans whatsoever. They're eliminating Medicare totally.
Providers can choose to opt out of the Medicare system. And if a provider opts out of Medicare altogether, Medicare would not cover that provider, or a Medicare Advantage plan would not cover that provider. A member would need to have a private pay agreement set with that particular provider. And if a provider decides that they don't want to participate and opt out of Medicare, they have to do it for a 2-year period. So that's a separate one-off situation.
Okay, but then that means we cannot use Hospital for Special Surgery. They would no longer.
No, the Hospital for Special Surgery is a Medicare participating hospital. This particular provider that you're inquiring about, they might be opting out, not the hospital. The hospital's not opting out of Medicare. They're not doing that.
Oh, because that's what I thought she was saying, that not
no, the
just
hospital,
the doctor,
the hospital will not
hospital.
opt out of Medicare.
Oh, okay. Thank you for the clarification.
It's an important question, Virginia. Thanks for posing it. Let's go to Ralph and then to Lester, please.
Yes, I had 2 questions. The first is, are Columbia Presbyterian Hospital and Mount Sinai part of this Advantage Plus?
Yep, both of them are participating hospitals.
Okay, and the second question was, how can we obtain a full set of the charts which Kim presented this morning?
The pre-enrollment guide, which will include the full benefit summary and a side-by-side comparison, you can access that directly from the OLR site. So if you want to look at a copy of that prior to your hard copy coming in the mail, you can access that right online.
Can you tell me again what the OLR site is?
We'll post
it put into the chat.
We'll put it into the chat.
Thank you very much.
Ralph, thanks. Let's go to Lester and then Cecilia.
Hi, sorry about that. Can you hear me, I presume?
Yeah. Yeah.
Yes.
Okay, thank you. So I really do appreciate that most of your members currently have GHI and are probably state retirees. We are on Aetna through TIAA, and I have not been able to receive any information from either the city or from these meetings on whether or not we can continue with our current Aetna plan if we opt out.
You will be able to continue with your current Aetna plan if you choose to opt out. You will pay an additional premium to keep that Aetna plan, and that additional premium will probably be posted over the next few days through the city of New York.
Okay, are we having city people here after this, James?
Sorry, do you mean from the Office of Labor Relations?
Yeah, from OLR, yeah.
No, I think if you have questions for OLR, you should go ahead and ask them during this segment.
Okay, well, it's the same question. When are we going to know how much the Aetna premiums will be and how they affect the TIAA annuity? Thank you.
That, as Kim said, the Aetna premiums and premiums for the other plans should be posted on the OLR website this week. We're just waiting for confirmation from Aetna and the other plans.
Okay, terrific. Thank you. I do appreciate it.
Thanks, Lester. Let's go to Cecilia, please, and then Jane.
Yeah, two quick questions. The first is NYU Lango a participating hospital in this?
Yes.
Yes, all right.
Yes.
The other question is, in terms of pre-authorization, when it is requested for surgery, what criteria does the system use to determine whether or not that surgery is to be allowed? And if the surgery is not allowed, if it's disallowed, what is the patient supposed to do?
The criteria that's used for the pre-authorization is the same medical necessity guidelines that are used by Medicare. So it depends on what surgery you're having done. It could be a whole host of different criteria that needs to be met depending upon the surgery. If the pre-authorization is denied, the provider and the member have the opportunity to appeal, and it will go to a medical director for review and appeal. And then if it needs to go to a peer-to-peer review outside to a third party, it could do so as well. But both the member and the provider have the ability to appeal that decision.
Is age a criterion?
It depends on what you have to have done. So there are certain things, for example, I'll use a Cologuard test for colon cancer. Medicare does have an age criteria. They only allow it for patients 50 and older. So we follow the same guidelines that Medicare does. So it's not that there's going to be a surgery where someone's too old for it, but there are certain medical necessity guidelines that Medicare has in place that we follow as well.
Thank you.
Cecilia, thanks. Let's go to Jane and then Anne, please.
Okay. I have a question. What about drug coverage under this? You know, under a standard Medicare Advantage plan, you also get your drugs through them. Are we going to continue with what we've got now?
We are.
Okay. And
sorry, Kim,
also,
I jumped ahead of you, but the welfare fund benefits that are currently in place, including the drug coverage, remain in place. Kim, feel free to elaborate, but I just wanted to jump in on that.
You covered it, James.
Okay.
The pharmacy benefit's not impacted by this change.
Okay, great. And what happens, if anything, to the TIAA amount that we had to annuitize to stay in the old plan? Do you know what happens to that?
I cannot speak to that. I'm under the impression that that's not impacted by this change, but I don't know if there's someone from PSC CUNY or Claire, if anyone knows about how that the annuities are impacted.
I don't know. I'm sorry. I don't know about the annuities. Maybe Donna.
James, can you hear me? This is Debbie Bell.
Yeah. Hey, Debbie. Thanks. We're working on it now. So Debbie, go ahead, please.
For those on TIAA, the union, most city employees, retirees who are covered by this plan have a city pension plan so that premiums are deducted from their pension. And that will be the case for TRS participants. TIAA, because it is a very different plan, has a different structure, and the union is scheduled to meet with CUNY and ultimately with TIAA to be able to give you answers to these questions.
Okay, thank you very much.
So we'll have to stay tuned and get back to folks on that one. Jane, thanks. It's a question a lot of our retirees have asked. Anne and then Esmeralda, and we have about 30 hands raised, not to rush anyone, just noting it. So thanks. We'll try to get to as many people as we can. Hi, Anne.
Hi, everybody. I'm hearing a back. Okay. I guess my question is for Claire. And this is about the $191.57 and the $2.83. This is a 5-year contract between Medicare Advantage, whatever it is, plus, and the city. This premium, is this written into the contract so that for the 5 years of the contract, this cost will remain the same, the $191.57 for the for keeping senior care, and the $283, I pay that out of my pension. Does that also cover my husband, or will it cover my husband? But more importantly is the first part of the question, I think.
The senior care rate has always been renegotiated every year. Part of the reason that the city has looked to a Medicare Advantage program is that the rates have gone up every year. We don't know if the rates will go up or the rates will go down on the senior care program. I guess it depends on the utilization of the program and how many people stay in that program. The zero premium Medicare Advantage plan is guaranteed for 5 years and beyond to be at zero premium. And I should point out that at the zero premium, it includes 365 days of coverage. So there's no additional charge for the 365 days of coverage in the Medicare Advantage plan. The $283 charge in senior care for the senior care is the individual. So it's 2 times that if you're covering a spouse as well.
Thank you.
Sorry, I realized I muted myself. Okay, and thank you. And folks, if you're not asking a question or responding, if you could go on mute, that will help with the tech feedback. Esmeralda is next, and then we'll go to Adina, please.
Thank you, folks. I appreciate all the hard work and the effort on our behalf. I have 2 basic questions. Number one, I didn't hear anything about mental health coverage. And if everything is the same, just say everything's the same. And the other question I have is more specific to me. This is the first I'm hearing about any. I'm not getting any I retired last year, and I'm not getting any correspondence from PSC or OLR, nothing. I heard about this through Halliday. So could somebody please get me in the loop? Oh, the other thing is I did not receive my premium reimbursement either.
Esmeralda, on the first thing in terms of staying in contact, if you're able to put your contact information into the chat, we'll make sure we update the records. I know that's something that our retiree chapter is eager to do. So apologize if we haven't reached you recently. Was there another part of Esmeralda's question that Claire?
Yeah, I didn't.
She reached out to OLR directly about the Medicare Part B reimbursement.
I did, and they told me to talk to the union.
All right. I'll get your name. I'll get your name from James or from Donna, and we'll look into it.
All right. Thank you very much. I'm putting my stuff in the chat. Thanks, everybody.
And I think just Esmeralda also had a question about mental health at the top. You want to respond?
Mental health is covered under the program, and so it outpatient or inpatient services. If it's an outpatient mental health visit, it would be a $15 copayment, but it's included under the plan.
Thank you.
And I see, let's go next to Adina and then Mal. And I know one question that people have had, I don't think has come up yet, but it's a recurring one. You've talked about the opt-out deadline of October 31st. I know there's a number of questions about being able to then opt back in later, or whether there'll be an annual opt-out period down the line if people end up enrolling. So maybe at some point in addressing folks' questions, you can address this issue about the windows and the and that question about moving between programs when that is and isn't permitted. Sorry, Adina, please go ahead.
Okay, I have what I hope are two brief questions. First of all, for the pre-authorizations, how long does that process take? Because I know I've had a fairly painful orthopedic problem for the past year and almost daily migraines. So we've been experimenting with lots of stuff. And how long, if there's a pre-authorization, would I have to wait for an injection or an MRI to be approved?
It depends on what service you're having done, and it depends on the urgency of the need for the service. So if it's an urgent situation where you need to have it done quickly, it's done within 24 to 48 hours. But if it's something that's down the road that's planned, it could take a couple of days. So it depends on what you have to have done and the urgency of it. So it can be expedited in those circumstances where it needs to be done very quickly.
Okay, now you talked about pre-authorization being needed for physical therapy. I know that Medicare allows, as a matter of right, a certain number of physical therapy visits a year. And then Medicare on documentation will allow additional visits if the therapist and one's doctor should provide documentation that they're needed. Will this be the same thing?
It will be based on the need of the patient. So you will not be capped at any certain number of physical therapy visits for the year. It's going to be based on the number that you need and what your doctors are recommending. So the same process will occur where the plan will ask for the medical backup and the medical criteria to extend additional physical therapy visits. So it's based on your individual.
One more question. I'm puzzled by what you said about HSS accepting payment from the Medicare Advantage plan, because in April, when I was at HSS for a visit, which included x-rays, I in fact asked, and they said, yes, they did accept. I didn't know the name of the plan, but I knew that it would be a PPO, including Blue Cross Blue Shield, and they said they would accept it, but it would pay only 20% of the cost, and that the patient would be responsible for the remaining 80%. So technically, yes, HSS would take that medical advantage plan, but they will take it for 20%, that's not terribly good.
No, that's not correct. There may have been some misinformation that was given out. We will pay hospital for special surgery the full Medicare allowable amount, and the only thing that the patient is responsible for under the plan is their applicable copayment. So if it's a provider visit at the hospital, it would be $15 specialist copay. If it's an inpatient hospital admission, it would be the $300 copayment. So there may have been some misinformation that you were given. I'm sorry.
How about for an x-ray or an MRI? Is there a separate $15?
It'll be a $15 copayment for an MRI and a $15 copayment for a specialist visit.
And an x-ray would be $15?
Yes.
Okay.
I'm thinking that the information that you received in April about a 20% payment had to do with the Blue Cross, with the Blue Cross Senior Care Plan. This plan had been announced back in April.
Specifically said that my union was thinking of moving to medical advantage plan. The person who was in charge of billing warned me
against medical advantage plans, and this one in particular, and told me that I would be much, much better sticking to traditional Medicare and making sure I stuck with it, because if I got on an Empire Medical Advantage plan, they would accept it, but for only 20%.
Yeah, this plan hadn't even been announced in April, so it's unlikely that they knew about this plan back then. And we certainly have confirmation from HSS that they are going to be taking this plan.
For the
Thank
full
you.
amount. Okay.
Thanks for your questions. I think for the sake of time, I want to take a couple more questions. Then I'd like to ask Bill Friedheim, the retiree chapter chair, to give him a minute to also to synthesize any additional issues or questions for Kim and Claire, Bill, that you might like to do. But first, let's go to Mal and then Edward, please.
Thank you very much. It was mentioned before, if a person predeceases their spouse, that the spouse would have the option of continuing this plan at $750 a month. That's about $90 a year. I find that a little bit too reasonable. But the other question about that was previously, if a person predeceased their spouse and they kind of lost the plan because they wouldn't get to keep it, they went on the COBRA group plan. Is that still an option or not?
Yes, you go under the COBRA group plan, but for Medicare Advantage, the premium will continue to be will continue to be zero after the first year.
Even though the wife was not a city worker.
Yes, there's a COBRA period of 36 months that your wife would be eligible to continue her coverage.
Well, I believe this is a lifetime group plan, COBRA for life.
It's a lifetime. If she's eligible under the lifetime group plan, she'd be eligible for the Medicare Advantage for a lifetime.
Okay, so she would have to go on the COBRA to get Medicare Advantage, just like GHI in the past.
Right.
Okay, quick question might be helpful to other people. My wife has her own health plan, so it's secondary under Medicare. Under this new plan, how would she get billed? Because I use hers as tertiary and she uses mine as tertiary.
I guess that's a question for Kim.
It looks like Kim may have gotten dropped.
Okay, I'll call the number and find out. I don't want to hold up the questions, all right? Thank you, everybody.
Thanks, Mel. I'm sorry. Maybe if we could try to get Kim back in. We'll wrap up this segment in a few minutes. Edward, please.
Oh, thank you. I just had a question about the following hospitals, if they would accept by contract the Advantage plan, like New York Presbyterian and Weill Cornell.
Yes.
New York Presbyterian, Columbia.
All of those are in network.
Yeah, the NYU Orthopedic Hospital.
In network.
And NYU Lango and Winthrop.
In network.
Yeah. Okay.
Thanks, Edward.
Thank you.
I think we have time for one more, and then we'll go to Bill to try to synthesize some things for folks. And I apologize for not being able to get to everyone this morning. Let's go to Barry, please. Barry Smith.
You're going to speak for me.
This is Barry's wife, actually.
I'm going to have
Barry's wife.
She speaks better than I do about these things.
Okay, so I just want to straighten out something here. Essentially, what you've been telling us in this meeting is that we get Medicare coverage exactly the same as our Medicare is at the moment. So what we're really talking about is the backup plan that our TIAA benefit has been providing for us. I'm assuming the backup plan, which is now GHI, is now going into Advantage. Am I correct in that? Can somebody answer this?
I'm sorry, we don't, at OLR, we don't know about the TIAA plan.
Well, we get Medicare. I'm his spouse, so we get Medicare on his retiree plan. And as a retiree, and the city pays for our Medicare at the end of the year.
Mm-hmm.
As a retiree, he also gets a backup plan, which we've taken out an annuity for. So I guess the union can answer this. And that is our GHI Emblem Health. Now what we seem to be talking about is changing our backup from GHI into Advantage. Because from what I've been hearing, everything else is exactly the same. The Medicare benefits are the same. So that is question number one. Are we talking about simply changing our backup plan?
Sorry, Barry and Barry's wife, that doesn't make sense to me the way that you've expressed it. I might ask Debbie, if you're still on, to step in and try to disarticulate some of the pieces that Barry's wife just expressed.
I am still on, but I'd appreciate if she tried to re-articulate the question because it wasn't clear to me either.
Right. James, can I step in for a minute?
Sure.
This is Donna.
Hey, Donna.
Hi. I think the backup plan is I think what's throwing everybody for a loop. You have Medicare A, you have Medicare B. I think what you're saying is you're talking about your 20%, which is your GHI senior care.
Yes.
Medicare, yes. The Medicare Advantage plan is now actually doing Medicare B and the senior care together. And that's what you're talking about.
That was my question. Yes.
They're doing both things together. They're just doing, instead of you having Medicare B and the extra GHI senior care coverage, they're just putting both of them together and doing both together.
I get that. Okay, so I just wanted to straighten that out. So now our TIAA annuity that was negotiated as a benefit through whatever wages in the past, are we still obliged to be paying that and taking out that annuity to support this new plan?
And that's what Debbie Bell was talking about. They're still trying to unravel that, and they're still working on that, and there still is no answer to that at the moment.
Right, but we still only get like a month to opt out or not. So it's a difficult question. I mean, only because if people have to make a decision, and this is a very life-changing decision, I think they might want to know what the ramifications are before they make that decision. So
it's not going to affect your annuity at the moment. The point is that it's not going to affect your annuity at the moment, one way or another. Difference is that if you're going to stay in the annuity, you may or may not. And again, this is still a question that needs to be answered. It sounds like Claire is saying that there may be other options to paying the additional monies, which sounds like it's going to be about, for both you and your husband, an additional $400 a month if you decide to go with the GHI. Right. There may be other, instead of money to the annuity and paying for it, there may be direct bill involved, but that's all to be decided. So I don't think that you need to address that at the moment in order to make a decision. Okay. I think the decision may have to be based on whether you want to pay the additional monies. How you pay it, I don't think has to actually.
I do understand what you're saying. I just needed to make that very clear because right now, this is our benefit, and we're actually being asked to give up our benefit for another benefit. And I think everybody's trying to figure out if that other benefit is concomitant to what we've been paying for right now. So that was what I really wanted to straighten out. I also wanted to ask very quickly that there are providers who accept Medicare. Are there providers who accept Medicare but do not accept Medicare Advantage? Is there a distinction between those two plans?
Is Kim still on? Does she want to handle that? Or is she gone?
I think Kim got dropped, unfortunately. Claire, I don't know if that's something.
I think I can address that. There are providers who accept Medicare, but say that they don't accept Medicare Advantage. The Alliance has a concierge service that will deal with those providers. Since they pay exactly the same as the provider would get from Medicare, in most cases, they can make arrangements with that provider to take the Medicare payment. And so even where they're not technically in the network, they can be treated like an in-network provider. This is a problem with individual providers, not with any of the hospitals, except for the unique situations with MSK and HSS. Oh, we have Kim back.
And you did a great job.
Thank you.
And, and James, if you want to circle just back to that tertiary insurance, that person that wanted to use that as a third party, I don't think that they're allowed to use that as a third party insurance. And I don't know if Kim wants to pick that up also. There was a husband and wife, and he had full coverage in another insurance company, and he thought that he could use the Medicare Advantage as a supplemental.
It wouldn't coordinate the way it would under a traditional type of program. So you won't be able to coordinate a Medicare Advantage plan with another program. The only thing that's slightly different is if someone has TRICARE and they use TRICARE as a retired military for their prescriptions, that can continue. That's the only time where there's a tertiary type of plan that would coordinate.
Thank you.
Thanks, Kim. I'm gonna ask Bill Friedheim, Bill, if you're available, if you could come in now, and again, I'm gonna apologize to the others who have been waiting to ask their questions patiently. I'm gonna refer you to the links that we'll drop in the chat from the Executive Director, Dean Hubbard, for where you can go to ask your questions. But Bill, I think you wanted to jump in and close out this segment for us.
Yes, I just simply, you can hear me?
Yes, we can.
Okay. I simply want to ask Kim and Claire to clarify a few questions that have been asked. Actually, I have three. Let me ask them one at a time. Kim, you said that members would have access to any of the 850,000 doctors who accept Medicare, although you claim that there are, what, 640,000 in your network. I think, as Claire just explained, access doesn't necessarily mean that a doctor or a medical provider will accept this plan. Maybe in many cases they will, but access means that, yes, you can go to any doctor who accepts Medicare. Whether they'll actually accept this plan or not is a case in point. Is that correct?
Providers can decide that they do not want to accept the Medicare Advantage program, but the program will cover in or out of network providers. Now, in the rare case where a provider says, I do not want to accept the Medicare Advantage plan, I'm not going to bill the plan, the member would be able to pay for those services, and we would reimburse the member the Medicare allowable rate. So that provider is still bound by the Medicare maximum billing laws. So the most that that provider could charge the member would be up to the maximum Medicare billing amount, and we would reimburse the member up to that maximum Medicare billing amount. We really want to try to take the members out of the middle. We don't want to have them pay for a provider and then wait for reimbursement. So in those cases, we ask members to outreach to us, the plan, so that we can contact that provider on behalf of the member to help educate them on how the program works, how the billing process works. Most of the time, it comes down to the fact that the providers want to make sure that they're not going to be paid any less than what they would be under traditional Medicare. And once that's explained, typically we can work everything out.
Okay, second question, and then I have a third question. And again, I'm just simply following up on what other members have asked. there's been a lot of concern about access to HSS and MLK, and you addressed that, and I assume that you've probably had these questions in other meetings with unions and have addressed it. But here's where some of the confusion comes in. A number of members, including some who spoke up today, claim that when they contact HSS, I don't think anybody talked about MLK today, they were told by somebody at the other end of the line that they knew nothing about this, or that it wasn't the case, or in some instances, while the hospital might accept the Medicare Advantage Plus plan, individual doctors may not. This is simply what I ask. You said that there's an agreement between the Medicare Plus Advantage, your Medicare Plus Advantage plan, and HSS and MLK. I think it would ease members' concerns if you could just simply show us the documentation of that, so that they in turn, when they go to HSS or MLK, can say, here's the documentation, there's an agreement in place. Can you provide that documentation?
We do not have an actual contract with those facilities, so they're not in-network participating facilities today. So we do not have a arrangement or a contract that's in place. What we have is verbal acceptance from both of those facilities that they will continue to see Medicare Advantage members on an out-of-network basis. So both of those hospitals are actually seeing current Empire Medicare Advantage members today, and we would pay them on the out-of-network side, but we do not have a contract with them today. We are working on trying to establish a contract with them.
Well, I think people would like to see the contract. I mean, verbal acceptance by itself doesn't inspire consumer confidence. And this is not an attack against, against you. I think it's really important that you provide the consumers, in this instance, the 240 or 250,000 municipal retirees, that you provide them, with some kind of documentation that indeed this is in place, because people continue to make calls to those two hospitals, to medical providers at those two hospitals, and continue to get confusing answers. Third question about opting out. As both of you have indicated, and as James has indicated, one of the enrollment guides is now online. And I just simply want to note for people on this Zoom session that Dean Hubbard has been dropping URLs, links into the chat periodically, including a link to our website, to a page that's entitled What's Happening to Retiree Healthcare. And on that are links to the OLR FAQs, links to a notation about the toll-free number that the Alliance is providing, other important links, and also a link to that enrollment guide that is now online. People should look at it, since it probably covers most of the people who are on this call. I mean, correct me if I'm wrong, Claire or Kim, but the guide that's presently online is for everybody who's presently covered by New York City Senior Care, right?
That's correct.
And then, Claire, I believe that you said that hopefully in a couple of days, you'll also put the enrollment guide up there for people who are on HIP, HIP VIP, or Aetna, or whatever other plans the city currently provides. And we will also put those links on the PSC website.
Good.
So on the enrollment guide that's up there, and that's the enrollment guide that most of you are going to get in the mail, hopefully sometime between now and September 15th. On pages, I believe it's 33 to 35. In fact, on page 35, you have an opt-out form. I've got some questions about this, and I think this concerns a lot of the people in this on this call. I mean, many of whom will sign up for the Medicare Advantage Plus plan, but also probably many of whom will choose to opt out. it seems to me, and you can correct me if I'm being unfair here, that it's a little bit of jumping through hoops to do this. The form that you have indicates that you can only opt out if you continue on the senior care plan, pay, as you said before, the $191.57 per month. And if you want it for the 365-day rider, another $2.83 per month. If you want to opt out entirely, it seems to me that there's a separate form that you've got to sign up for. And if you opt out entirely and don't stay on the senior care, what you indicate is that you will not get a Medicare Part B reimbursement. That's correct, I assume.
Correct.
What I'm saying. And then there are a number of ways you can submit the form. One is electronically. If you submit it electronically, is that process encrypted? Because people are asked to put their Medicare number on that. They're asked to put their Social Security information on that. I think these questions are going to come up in terms of, protection of information when people submit an opt-out form. And also, how is that verified? Because right now the default is that if you don't do anything, or if somehow the city doesn't get your opt-out form, if that's what you choose to do, you are in the Medicare Advantage plan. There's got to be some way that members can verify that indeed the city has received their opt-out information. And then the one other thing that I just want to ask about this is the City Council passed Local Law 39 in 2001, providing that, quote, the city shall reimburse covered employees in an annual amount equal to 100% of the Medicare Part premium rate applicable to that year, unquote. The law identifies those who are eligible as, quote, city employees, retirees, and their dependents, unquote, who are enrolled in the, quote, hospital and medical program for the aged and disabled under the Social Security Act. That's the Medicare program. That law seems to suggest that the Medicare Part B reimbursement should continue for anybody who is enrolled in the hospital and medical program for the aged and disabled under the Social Security Act, not just simply people who are either in the Medicare Advantage Plus program or opt out and choose to remain in the senior care program. So I guess my question is multi-layered, and I guess it's really for both Kim and Claire to answer the separate parts of that.
Maybe we could
take. Do you want to answer the Part B reimbursement, and then I can handle the opt-out process and the forms and all that?
Yeah, I mean, I'll certainly run it by our attorneys in terms of what you're saying about Local Law 39. Our understanding is that to be an eligible retiree, you have to be signed up for one of the city programs, and maybe it falls back to what the definition of an eligible retiree is. But we will check it and get back to you, Bill.
Also, let me just ask a question, Claire. There's no place, or maybe Kim, this is for Kim, there's no place on the form to sign up for the 365-day rider. Is that a separate form? Can we streamline the process so that people only have to fill out one form if they opt out, where they can both, choose the New York City senior care and sign up for the 365-day rider?
I'll address the opt-out form itself. We wanted to provide retirees with multiple options to be able to opt out. So that's why we're accepting them in many different forms. So the retiree can fill the form out and mail it in, or they can fax it in, or they can access the encrypted secure site to opt out online if they choose to do so, or they can call the call center, and the call center representative can actually log and accept their opt-out as well. What's important about the opt-out form is obviously they're opting out of the City of New York Medicare Advantage Plus plan to keep their current senior care plan. What's important is that the retiree understands exactly what the cost of that plan will be, and that's why the premium was included. So if a retiree has the 365-day hospital rider today, that will continue. So that's all inclusive in that opt-out form. So if they have the base plan and the rider, they will keep both of those, opt out to stay on senior care with the rider. If they do not have the rider today and they want to opt out of the Medicare Advantage Plus to stay on senior care, they will have to get in touch with the OLR site to purchase the additional rider. So if they do not have that today, they have to notify the city that they want to purchase that rider today. That's outside of this Medicare Advantage transfer enrollment process that's occurring. So it's a separate function. I'm trying to think, Bill, did I address all of the layers of the questions on the opt-out form?
I think you did.
I'm sorry, this is Barbara Bowen. Can I just jump in for a second? Because there's so many questions, and I've heard the answer in previous sessions about future opt-out and opt-in periods.
Yeah.
Right. I'm glad you're raising that, Barbara.
So could you speak to that? Because I know there's been a lot of planning on that after this first decision is made.
There will be an annual open enrollment when you can opt out of the plan that you're in now and up back into senior care or in the Medicare Advantage plan. You're eligible to go between whatever plan you're in today and the new Medicare Advantage plan. Next year, if you've opted into Medicare Advantage, and let's say you're in an Aetna plan, if you don't like the Medicare Advantage and you want to go back to Aetna, you can go back to Aetna next year. After that, you'll be able to go between senior care and Medicare in each open enrollment.
And if you Claire, let's say for those who opt out into senior care, I mean, the enrollment form says that basically you're in senior care for the year 2022. Does that mean that next year, if you want to continue, I mean, I know you can choose then to change and go into the Medicare Advantage Plus plan, but if you want to continue opting out, do you have to do it every year between now and the end of this 5-year contract?
No, if you want to just leave things as they are, you won't have to fill out another form.
Thank you.
And just because I'm seeing these raised in response to things that folks have said, before we let you go, when people do submit opt-out, and if you said it, forgive me, will they receive confirmation or verification that that was their intention? Okay.
Thank you. I knew I forgot something, James. Once the opt-out is registered with the plan, we will be sending a confirmation letter to the member so that they understand that we've received the opt-out and it's a confirmation letter attesting to the fact that the opt-out was received. So they will get that.
And will that be by mail or by email?
It'll be by mail.
Okay.
It'll be a letter.
So that underscores, James, the importance of all the people online on the program today who did not receive the first mailing, the notice of change mailing, to both let the union know and the welfare fund know their correct current address, and to go onto the OLR site for retirees. There is a place to do address change there as well.
Debbie, thank you. Important. Thanks very much. Claire and Kim, thanks for being with us today and responding to our retirees' questions. Retirees, I'm sorry that we haven't had a chance to get to everyone. The questions are very, very good. It's a very complex process. Dean is going to drop in the chat again instructions for where you can ask outstanding questions. We do want to make sure everyone gets clear information. Again, the decision point is October 31st. And we know that even though that seems like a long time from now, these things have a way of creeping up. So we want to make sure everyone really is informed. We take it seriously. I know Kim and Claire with the Alliance and OLR that you do as well. Just so that folks know, this segment of the meeting has been recorded and it will be posted on the retiree website of the PSC webpage. So if you need to review anything that's been said here, you'll be able to do that. And I think even though we're at 10:30 and beyond, I'd like to invite PSC folks to stick around for 15 minutes or so that we can debrief after the OLR and Alliance reps leave. And we can talk about where things stand right now and address contextual concerns that you may have that Kim and Claire have not addressed. So again, thank you both for being here. Appreciate the time that you put into the process and the attention you're giving our retirees. You can be sure that you'll continue to hear from us, and appreciate your vigilance on our behalf. Thank you.
Thank you for having us. I appreciate it.